Christina, I think we probably have critical mass if you want to kick us off.
Great. Thank you so much, Dawn. And hello and welcome everyone to today's event to detail implications of the Congressional Reconciliation Bill on health insurance marketplaces, their consumers, and health systems. My name is Christina Coussart. I'm Director of Commercial Coverage at the National Academy for State Health Policy, and we support the State Marketplace Network, a collective of leaders from 22 of the state-based health insurance marketplaces. And first, I want to acknowledge that everyone is very busy right now. It is a very hectic time, and we really appreciate your time here to learn more about what this bill means for states, providers, and the 24 million individuals who are enrolled in the health insurance marketplaces. Many of you have seen and have even featured the headlines about 16 million Americans that are expected to lose coverage under the reconciliation bill, 8.2 million of which will lose coverage from the marketplaces themselves. The reconciliation bill's impact on the marketplaces will have a severe and critical impact on consumers, health insurance markets, and healthcare systems, driving hundreds, if not thousands of dollars in additional healthcare costs for Americans and significant added strain on our nation's providers and healthcare systems. So to speak more about this, we are very excited to soon hear from some SBM executives, as well as provider leaders and marketplace enrollees themselves. They will each introduce themselves in just a moment. And then in addition to our speakers, we have several directors from the state-based marketplaces here who will be available to answer questions during the Q&A. And we thank you all for being here. We will highlight them in a bit. Participants on this call will be muted. Following our speakers, we'll have approximately 10 minutes for Q&A. At that time, reporters can raise their hand to ask questions or put questions on the chat for the Q&A. And with that, I will turn things over to Kevin Patterson, CEO of Connect for Health Colorado, to kick us off. Kevin?
Thank you very much, Christina. To everybody that haven't met me, good morning or afternoon, depending on where you are. My name is Kevin Patterson. I'm Chief Executive Officer for Connect for Health Colorado, Colorado's official insurance marketplace. As Christina said, I'm here today with a number of my colleagues from around the country. We find ourselves at a critical juncture, facing multiple threats to the Affordable Care Act and the 24 million Americans who rely on marketplace coverage for their private health insurance. For last year, we've been talking with elected officials and other stakeholders about the importance of continuing the enhanced premium tax credits that will expire at the end of 2025 unless Congress acts. Those enhanced premium tax credits have made health insurance more affordable for millions of Americans and decreased the number of uninsured individuals across the country. At Connect for Health Colorado, like several other exchanges, we've had record enrollments for each of the past 5 years. If Congress does not act to extend the enhanced premium tax credits, millions of Americans enrolled in marketplace coverage will experience, on average, a 93% increase in their monthly costs. In Colorado, net premiums could more than double. The budget reconciliation package would also significantly hinder health insurance access, affordability, and choice. To start, it limits the long-standing flexibility that has allowed state-based marketplaces with autonomy to make decisions that best meet the needs of their customers. Additional measures in the proposed bill further cut financial help available for marketplace enrollees, and each of the measures is cumulative and adds additional costs for the consumer. If all these measures are included in the final bill and the enhanced premium tax credits are not extended, CBO estimates 8.2 million Americans may lose health insurance and become uninsured. In Colorado, we're projecting we could lose 48% of our exchange enrollees, and projections from other states are even higher. The numbers are or even significant to certain groups, including those who are over the age of 55 and those living in rural areas. But they're more than just numbers. They're people. These are our friends, our neighbors, colleagues, and relatives whose health and financial security will be threatened. You'll hear from some of those folks today. One of the measures the reconciliation bill aims to cut is silver loading. It's a practice that was added by states a few years ago after the federal government stopped cost-sharing reduction payments to insurance companies. The purpose of this is to help offset out-of-pocket expenses like copays and deductibles for lower-income enrollees and to lower premiums. Ending silver loading will further reduce advanced premium tax credits and increase premiums. We're also concerned about the new verification requirements in the bill, which place an unnecessary burden on both exchanges and the customers. Each marketplace already verifies information using federal source of truth data. The new requirements will result in significant delays in people receiving financial help and gaps in healthcare coverage. They will prevent exchanges from implementing effective auto renewal processes, which allow the majority of enrollees to seamlessly keep coverage year after year, a process that's the norm among employer-sponsored health insurance plans. Overall, this will impact 22 million Americans enrolled through the exchanges. They'll also be costly and onerous for exchanges to implement, requiring additional staff and unnecessary new processes. And they don't take into account the many self-employed and hourly employees with fluctuating incomes. Tax credits are calculated using prospective income, and these customers often don't know how much they will make in a year when they apply. They only know how much they're going to make an hour. Marketplace eligibility has historically been based on projected income. Those who earn more than projected pay back the difference on their tax returns. So the bill also specifies a unilateral 6-week open enrollment period. Previously, the length of open enrollment has been determined by the states. A shortened open enrollment period reduces our ability to reach customers and provide assistance. Historically, those who are younger and healthier are the last to enroll. Shortening the enrollment period will likely result in a loss of some of these people and adversely affect the risk pool. The restrictions on immigrants receiving premium tax credits will have a huge impact on this population. In Colorado, we estimate as many as 85% of this population currently enrolled through the marketplace could lose healthcare coverage. And it's important to understand that these are individuals who are lawfully present. They live, work, and file taxes in our communities. They've been eligible for marketplace coverage and premium tax credits from day one of the marketplaces. And they tend to have lower healthcare utilization, which means eliminating them will also adversely impact the risk pool. What's especially troubling about these cuts to healthcare, both to Medicaid and the exchanges, is that they rip through the safety net. Nearly 1 out of every 7 people in the United States have purchased health insurance through an exchange since the Affordable Care Act was passed. Many folks turn to the exchange during Medicaid unwind. But if this legislation passes and the exchanges aren't able to provide affordable insurance, millions of people will go without insurance. They'll put off seeing healthcare providers with an illness until it becomes critical. They'll visit the emergency room. Their own health will suffer, and the financial health of our hospitals, providers, and economies will suffer too, as we try to absorb millions of dollars of uncompensated care. Thank you for your attention, and I will turn it over to Jonathan Dayton.
Thank you, Kevin, for the introduction. My name is Jonathan Dayton, the Executive Director and CEO of the Maryland Rural Health Association. And I apologize that my camera's off, but I'm currently out of the office getting ready to head into another meeting. MRHA, or the Maryland Rural Health Association, stands committed on our mission, and we've been around since 1995. MRHA has brought together hospitals, local health departments, and community health centers, nonprofits, and community members to improve the rural health outcomes across the state of Maryland. We currently represent 18 of the 24 jurisdictions in Maryland that the state considers rural, which is about 1.8 million Marylanders who deserve the same access to affordable and quality care as everyone else. The expiration of the federal subsidies would pose a serious threat to the health and stability of Maryland's rural communities. The subsidies, including those provided through the Affordable Care Act or the ACA, are essential in making healthcare coverage affordable for rural residents, many whom are already facing systematic barriers to care. Without these additional supports, we will see more individuals forced to choose between basic healthcare needs and healthcare coverage, leading to increased rates of uninsured and delayed care. This ultimately results in sicker, less healthy communities. Rural Marylanders often face significant challenges in social determinants of health, factors like limited access to transportation, lower incomes, lack of broadband internet, food insecurity, and fewer healthcare providers. These conditions create daily barriers to accessing routine care, managing chronic illness, and even receiving preventative services. In addition, these longstanding trust barriers that we see in rural communities, especially among the underserved and historically marginalized populations, that have past negative experiences, lack cultural competent care, and limited local engagement from healthcare institutions all contribute to the reluctancy to seek care, even when it's available. The barriers can worsen when the coverage lapses. As patients become even more disconnected from the healthcare system, they may already view skepticism or apprehension. When you add obstacles like loss of federal subsidies on top of existing SDOH and trust barriers, the results are clear. Increased illness, unmanaged chronic disease, mental health crisis, and unavoidable hospitalizations. This cycle places enormous strain on the rural healthcare systems, especially small hospitals and clinics that often serve as the only source of care for families for many, many miles. We already know that the rates of illness and death are higher in rural than urban communities, and we would hate to see that increase. Preserving the ACA coverage is not just about insurance, it's about maintaining a lifeline for the most vulnerable populations. It's about giving rural residents a fair chance to lead healthy lives and keeping rural hospitals open and functional. And like I mentioned, I do have to hop off the call, but however, I will put my contact information in the chat. If anyone would like to contact me later for additional follow-up, please do not hesitate to do so. With that, I'm going to pass it over to some real stories and human impact to Jesse Green.
Actually, I think we're going to Chip next.
Yeah, thank you.
Yeah.
And I'll pass it off to Jesse in a moment.
We'll hear real stories soon.
My apologies.
No problem, Jonathan. I'm Chip Kahn, President and CEO of the Federation of American Hospitals. We represent over 1,000 hospitals across the country. We have a wide footprint, and I'm going to talk about that in a minute. I also want to thank the State Marketplace Network for focusing a light on this issue at this. It's important. Medicaid has been the big health discussion item in the budget reconciliation that's under consideration in Congress. But I think not enough attention has been paid to this critical issue that we're discussing now. My members represent 24/7 hospital care across the country, but I think it's important to emphasize that we are particularly have a large footprint in a number of areas of the country where there has not been ACA expansion, and the exchanges, the marketplaces, play a critical role to keep millions and millions covered. In a sense, I think with the Medicaid reductions, and I thought Kevin really outlined all the issues very well, with the Medicaid reductions that are included in this legislation that's being considered and likely to happen, the marketplaces will become a fallback, a very important fallback for millions. And the changes that are proposed in this legislation in the marketplaces, in a sense, present part of a perfect storm that faces the marketplaces and will make them less of a resource to those who need critical coverage if the Medicaid reductions and changes go into effect. What do I mean by perfect storm? Well, part is that in this bill, we have significant obstacles that will stand in the way of people getting coverage or remaining in coverage. As Kevin pointed out, some of the changes will lead to increased premiums. And finally, we don't have in here an extension of the enhanced tax credits that could come later in the year. But if it doesn't, this issue of affordability is going to stand in the way of millions receiving coverage, and some of the changes being made will mean that people who are eligible for coverage, eligible for the subsidies in the marketplaces, will find it difficult or impossible to go through the new requirements to qualify for coverage. We can't let these kinds of changes stand in the way of the coverage people need. We need to make sure that people get the right care at the right time. Hospitals are always going to be there with our emergency rooms, but we really want people, one, to avoid hospitals as much as they can. Insurance is important for that because it enables them to get care in the right setting, which most of the time is not a hospital. And second, when they do come to the hospital, we really want to separate this issue of finances from care. We want them to focus on the care that they need and allow us to focus on it. And without the critical coverage that's offered to so many millions through the marketplaces, which will be threatened by this potential action, it will stand in the way of people getting the right care at the right time and getting the kind of care they need. So I'll pass the baton to Jesse.
Jesse, you're muted. See if we can work on getting you unmuted.
There I am. There I am, yes. I think I'm unmuted. Yeah. Thank you so much. My name is Jessie Green, and I live in Lebanon, Pennsylvania, which is a more rural community in central Pennsylvania. My husband and I are small business owners, and we have been part of the Lebanon community for 30 years. I'm here today not as a policy expert, but as someone who wakes up every day trying to balance business, client needs, family schedules, and health insurance coverage. So as far as what the enhanced tax credit means to me, since 2000, my family has needed to purchase health coverage on our own. And after the Affordable Care Act was passed, we signed up for quality health care as soon as we could. Since 2021, my family and I have relied on coverage through Penny, which is the Pennsylvania version of the marketplace. And the enhanced premium tax credits really mean everything to us. So before the tax credits were in place, just so everyone understands, at that point, it was me and my husband and our teenage son, and we were paying $1,700 a month for health insurance. And that's a big bill. The savings since then have been significant, and it's allowed us to do all sorts of things. It's allowed us to do some more investment, more advertising in our business. It's allowed us to contribute to the community, donations to nonprofits, and just the things you do, patronizing local businesses. And yes, we did manage to send our son to school and pay those tuition bills. So that was great too. So the reconciliation bill, if this moves forward as it is written, these tax credits are going to expire. Based on what I've seen with some calculators out there, it does look like my premiums would be doubling, at least. As a small business owner, I really just can't absorb that kind of increase without making serious trade-offs. It'll mean belt tightening and tough decision-making. But we're going to do it. And the reason my family's going to do it is because I understand the importance of health insurance. Dropping coverage is not going to be a choice for us. Both my husband and I have pre-existing conditions, which is one of the primary reasons that we used and signed up for the marketplace from the start. The idea that we could purchase coverage on the private market is not a reality for us, for someone who's older, and for almost every small business owner I know. The premiums are too expensive, and just as importantly, many do not cover those pre-existing conditions that we need. I have several medical issues that require annual monitoring, and just one of those tests would cost several $1,000s out of pocket without insurance. Having appropriate healthcare coverage is truly a matter of life and death, and that is not an exaggeration. This is not a luxury. It's a necessity. And anyone who says anything different is either lying or they don't have personal experience with a serious medical condition. There are also new rules in the bill that would make it harder to renew my coverage or verify my information. As someone juggling a business and a busy life, I don't have time for mountains of paperwork, especially when Penny already checks that automatically. I don't ask for special treatment as a business owner. None of us do. But I do ask for affordability, stability, so I can plan, grow, and care for my family. This bill would take us backwards. It would mean fewer people in my town would have coverage, more small businesses and sole proprietors struggling with healthcare costs, fewer dollars staying in our local economy. It would mean me sitting at my kitchen table, trying to figure out how I'm going to balance those new higher premiums. Maybe I could scale back to a less expensive plan, but then I'm going to be dealing with higher deductibles, higher copays, higher out-of-pocket costs for prescriptions. These aren't easy decisions to make. I am blessed in many ways, and I'm happy to pay my fair share. But without subsidy help, many, many small business owners are going to really struggle with premium costs, and many people are going to fall through the cracks. Affordable health insurance shouldn't be a luxury. It shouldn't be harder to get just because you're self-employed or you're raising a family. Penny made it easier. This bill would make it harder. I have been trying to reach out to my local Pennsylvania senators to express how vitally important this is. And unfortunately, the best I can do is talk to an answering machine or type an email, which I've done. But today, I'm going to take this opportunity to urge lawmakers to protect the enhanced tax credits and keep small business owners like me and families across Pennsylvania and the country covered. Thank you.
Thank you, Jesse, and thank you to everybody. My name is Jason Piperberg. I'm a freelance illustrator and comic book artist living in Philadelphia. I work for myself, and I've been doing so full-time since about 2017. I'm also a cancer survivor. When I was 33, I was diagnosed with papillary thyroid cancer, which had spread from my thyroid into the surrounding lymph nodes in my neck. I needed 3 surgeries, 1 round of radioactive iodine, and many different appointments, scans, and tests throughout the process. That experience changed how I think about everything, especially my healthcare. As someone who's self-employed, I don't get health insurance from a job, and being self-employed means money is often tight. So prior to the enhanced tax credits and my cancer diagnosis, I'd usually opt for plans with low monthly premiums, and I'd hope for the best. But now, because of my medical history, skipping or choosing more minimal coverage isn't really an option. Having an option for health coverage through Penny has allowed me the opportunity to continue working for myself while also being able to afford good health coverage. Penny is what keeps that coverage within reach, and it gave me access to a plan that covered not only my surgeries and my treatment, but also follow-up care, my prescriptions, and the kind of preventative care that gives me peace of mind. Thanks to the enhanced tax credits, I've been able to afford a silver tier healthcare plan for about 4 years without sacrificing my income or draining my savings. And renewing my coverage each year has been incredibly simple, which gives me more time to focus on my work. And it's also given me access to a team of fantastic doctors who saved my life and put my mind at ease during my treatment and recovery. If this bill goes through, those enhanced tax credits will go away, and that means my premiums could jump by hundreds or even thousands of dollars a year. And that's not just a line in my budget, that's months of prescriptions and follow-up care. That's money I would otherwise use for my equipment, for my rent, or to just keep my business running. And on top of that, the bill adds more paperwork and makes it harder to keep or renew my coverage, everyone's coverage. And as a solo entrepreneur, I don't have an HR department, and I don't have time to chase down documents every time I log in. My work takes time. need me to hit. And if I have to spend hours on the phone or writing emails trying to sort out issues with my coverage, I won't be able to hit those deadlines, thus resulting in a hit to my annual income, not to mention a potentially damaged reputation, thereby making it even harder to afford the coverage that would be causing all these problems in the first place. I'm 35. I'm not looking for a handout. I just want to keep moving forward without worrying that my past diagnosis makes me uninsurable, and making sure that I can continue my follow-up care to be certain that my cancer hasn't returned, and God forbid that it ever does, I'll know early enough on in the process to handle it. Penny gave me that freedom. It gave me a sense of security I hadn't had in years, and that's what is at risk with this bill. Without the coverage I have through Penny, it's very possible that I would be dead right now. And the only reason I have been able to afford coverage like this that saved my life is because of the enhanced tax credits. This isn't just about numbers on a spreadsheet. It's about people trying to rebuild their lives after an illness. It's about solo business owners trying to grow. It's about making sure that surviving cancer doesn't mean financial ruin or fear of the next bill. It's about saving lives. We need to protect the enhanced tax credits. We need to keep Penny and all the other health marketplaces strong, and we need to make sure that the door stays open for people like me who work hard, who've already been through a lot, and who deserve a fair shot at staying healthy. Thank you for listening. Thank you to everyone fighting to keep this coverage accessible. And with that, I guess I'll pass it off to Hillary Schneider.
Thank you so much, Jason. I'm Hillary Schneider. I serve as the director of CoverMe.gov, Maine's state-based health insurance marketplace. As you've heard today, we're deeply concerned that an estimated 8.2 million Americans who rely on marketplace coverage throughout this nation, people like Jason and Jesse, will be unable to maintain affordable private health insurance under the House of Representatives' recently passed reconciliation bill. For those that remain eligible for the marketplace, coverage will be more expensive and require additional paperwork and steps to enroll. Consumers will have a shortened timeline to compare options and make important financial decisions that require predicting future healthcare needs. While there is help for consumers in the form of navigators, brokers, and marketplace call centers, those resources will be strained to meet consumer need due to a shortened timeline and additional new processes that need to be put in place without adequate timing for planning and thoughtful implementation. Our marketplace is estimating that the initial implementation costs will consume nearly 1/2 of our overall operating revenue. Our marketplace operations are funded primarily from a user fee based on Our marketplace operations are funded primarily from a user fee paid by the insurance carriers that operate in the marketplace and applied as a percentage of the total monthly premiums collected for plans sold through the marketplace. So it's essentially a user fee on the users of the marketplace. Currently, the assessment in Maine is set at 3%, which is the cap set in state law. If we need to raise the user fee to cover the millions of dollars to implement these proposals, we would need approval from our state legislature to do so. Yet this is unlikely in 2025, as our legislature is in the final days of session this year and will not reconvene until next January. Having worked in health policy for more than 2 decades, I highly doubt that our elected officials intend to cause the harm you have heard about today. But these impacts are the reality behind changes that on the surface may appear budgetary, highly technical, well-intentioned, and reasonable. This is why we are all here today, taking the time to ensure policymakers and the public are aware of the human and economic impact of this federal budget proposal. In Maine, nearly 65,000 residents rely on coverage through our marketplace, representing nearly 80% of the population who purchases health insurance on their own. These Mainers have no other source of health insurance that is affordable and accessible to them. They are working class individuals, often self-employed, working for small businesses or in hourly wage jobs. They are home care workers, hairdressers, servers, rideshare drivers, technicians, seasonal tourism workers, farmers, lobstermen, gig workers, and early retirees. They represent all ages, political views, and backgrounds. These individuals and families drive our local economies and make both our rural and urban communities thrive. Health insurance marketplaces are critical in supporting a healthy healthcare delivery system, often both of rural critical access hospitals by covering more of their patients with private health insurance coverage. CoverMe.gov and the health insurance marketplaces across the country serve as a vital resource during transitions in income or unexpected life changes. Take Stephanie, a hairdresser who lives in a small rural town in Maine with fewer than 7,000 residents. Stephanie and her husband had coverage through his job at a mill. Her husband got hurt, he became ill, and he lost his job. And with it, they lost their health insurance coverage through his employer. Stephanie went to work at the local hospital to get health coverage, but the hospital closed and she was laid off. She went back to work as a hairdresser, but needed health coverage. Stephanie feels fortunate to have found coverage through CoverMe.gov so she can stay healthy while also caring for her husband and aging mother. In Stephanie's own words, marketplace coverage allows families like hers to survive and live with dignity. The federal reconciliation bill would put coverage in jeopardy for individuals like Stephanie by making coverage more expensive and making it harder to enroll. In fact, as you heard, the Congressional Budget Office estimates these changes will result in 1 in 3 marketplace enrollees nationwide losing coverage. The situation will be made worse by the impending expiration of enhanced healthcare tax credits, which will increase monthly premium costs for most marketplace enrollees, leading to even higher premiums and greater numbers of people going without coverage. Many of the proposals we're discussing today will have impacts that are opposite of their intent. For example, shortening the enrollment period, restricting eligibility for lawfully present immigrants, and requiring additional paperwork and processes will result in fewer, younger, healthier consumers in our markets. National research and the experience of operating our state marketplaces tell us that individuals with health conditions will pay more and jump through more hoops to get coverage. This is not true for younger, healthier consumers. Health insurance markets thrive when the maximum number of people are covered, and there are significant numbers of younger and healthier consumers to balance out the higher costs of consumers who are older, have health conditions, or live in rural areas. As the oldest, most rural state in the nation, attracting young and healthy consumers to Maine's marketplace is critical to our viability. In the past 2 years, we've invested resources in targeted efforts to attract this population, and it's starting to work. As recently, we've been seeing the largest growth in these younger cohorts. Now this success is under threat. If past experience plays out, these federal proposals will result in greater coverage losses among younger, healthier individuals, which will destabilize Maine's private health insurance market and put the sustainability of our state-based marketplace at risk. Marketplace consumers will not be the only ones adversely affected. Maine has what's called a reinsurance program. This program protects insurance companies from unexpected high-cost claims by covering some of the costs. This helps reduce premiums for the individual and small employer markets. If the marketplace risk pool is less healthy, the reinsurance program will be spread thinner, which will also drive up premiums for small employers. Marketplaces will be forced to spend millions more to implement new duplicative paperwork requirements, costs that will be passed on to consumers who depend on our coverage. State-based marketplaces operate with state and federal oversight. We take seriously our responsibility not only to provide access to health coverage for the consumers we serve, but also to be good stewards of public resources and public trust. On behalf of the nearly 65,000 Mainers Maine's marketplace serves, and the millions of Americans served by marketplaces across the country, I ask our federal policymakers to examine these proposals carefully and work to find solutions that protect coverage for those enrolled in marketplaces today and in the future, and reject any proposals that would impose unnecessary and unprecedented red tape, take away the autonomy of state-based marketplaces that has historically been granted to us, and helping people get and stay covered. Now I'll turn it back to Christina.
Thank you so much to everyone for all of your comments today. Hillary and Kevin for highlighting the complications of the bill, including predicted impacts on your consumers, very real operational concerns related to the aggressive timeline for implementation of these challenges. Chip and Jonathan for your perspectives on, in Chip's word, the perfect storm of these changes and how they may stand in the way of people getting the care providers, and Jason and Hillary for your stories on what coverage has meant for you and your families, and really the importance of it to helping sustain your businesses and your own personal health. So really appreciate all that. With that, we will turn it over to Q&A. And again, all are welcome to ask their questions in the chat, or we can unmute you if you raise your hand and have a question for our panel. Right now, we are pinning the marketplace executives as well as our speakers, so you have a sense of who is available to answer some questions. And just to be clear, that questions will be accepted from reporters only at this time. And if no immediate questions, I will kick things off with a question to the panel. A few of you did speak
Yeah,
to
question.
some of the challenges that this bill will present in just marketplaces piece of the coverage landscape, that it impacts marketplaces, but also the transitions of coverage between programs, marketplaces as a landing space for consumers that are coming from all sorts of backgrounds. I invite anyone else to speak a little bit more to how the changes in the reconciliation bill will really impact those transitions and the capacity of marketplaces to serve as that space for Americans.
Christina, I think we did have one question from the press from Paulina, maybe before we go there.
Okay, go
Sorry.
ahead. Paulina,
Yes.
sorry about that.
Yes, I'm Paulina Oaxaca from Univision, and I was wondering if there's anybody that could share with us a few words in Spanish, just a summary of what the impact of this bill will be for the Hispanic community.
Go ahead, Jessica.
So I do not speak Spanish, but I do believe that our Spanish spokesperson may be on the line. Patty, are you on the line and able to unmute?
Yes, hi everybody. Hi Jessica. Yes, I'm here. I can help with the innovation media request later. If you want, we can do a separate meeting on Zoom with the reporter. You want to give me your name again and we can just set up a meeting like probably in the next 20 minutes if that works for you.
Okay, yeah, that works for me. Again, my name is Paulina Estrada Oaxaca from Univision, and I can, if you can send me your email in the chat, and
Okay.
I'll send you a link.
I will do that. Happy to help here, and of course, supporting all our marketplaces in this time that is so difficult for all of our ethnic communities.
Thank you so much.
Good. Okay, I'll post my information in the chat. Thanks.
We have another question, Christina, in the chat from Maria. Can one of the guests elaborate on the expected effects of cutting subsidies to low-income people and impact on Latinos specifically?
I'm happy to just start, and if others can chime in. I think we could follow up potentially with more demographic detail, but I just want to note the elimination of tax credits for lower income individuals, whether it's the changes that are being proposed here for lawfully present immigrant populations, and the administrative red tape that you heard about here that will just make it more difficult for people to access those tax credits, even if they do still technically apply. We know that those tax credits are what makes this coverage possible for people to obtain and to stay in. Lower income individuals are not able to afford a full freight premium. And so these tax credits are the glue that makes it possible for people to get into that coverage and stay in it. So we know without them, people are going to put off care, not access care. That deteriorates their own health, their own financial stability, and it also has downstream effects on healthcare systems and hospitals because they're still going to show up to the emergency room and those costs will be borne elsewhere. But the impact to low-income populations, Latino and otherwise, are very significant here in terms of the people who will just full stop, no longer be able to access this vital help that is what makes coverage possible for them. And we know when the Affordable Care Act was passed that one of the populations that was most at risk of uninsurance at the time, that these programs, marketplaces, and these subsidies were directly designed to assist, were the Latino populations across the country who had the highest rate of uninsurance in the entire country. So the progress we've been able to make through these tools, subsidies, marketplaces, et cetera, has been advancing those coverage gains in the Latino community, and there is just so much at stake that can be lost here.
Thank you, Audrey. And hi, everyone. Jessica Altman from Cover California wanting to add in here. First, I did put in the chat a fact sheet from Cover California that speaks specifically to how the expiration of the enhanced premium tax credits will disproportionately harm our communities of color and our Latino communities, which may be a helpful resource to you. I also just want to second, right? When you think about the expiration of those tax credits, again, it is both taking away tax credits altogether from middle income enrollees and reducing significantly the tax credits available to our lowest income enrollees. And so for all of our lower income enrollees, if those expire, there will be a financial hit to them of no question. And across some of the income groups in California, even a doubling of their monthly payment at lower income levels. Also, speaking to the reconciliation package, I want to re-emphasize the significant reductions in lawful immigrants who would be eligible for the financial support that we offer, who are, of course, disproportionately Latino. So groups who are covered today, including DACA recipients, refugees, asylees, all groups in those categories other than really green card holders and a couple of other small immigration categories, again, lawful immigration categories, would lose access to the financial support altogether that they have today. And then finally, just an experience from California. We have also talked a lot about administrative barriers to coverage today. And I would just reiterate that those are hard if English is your primary language and you're looking to navigate our healthcare system in English, but even harder if English is not your primary language or you are not an English speaker. And while state marketplaces like California will be working to support our Spanish dominant enrollees as much as any other, there are added challenges, and that won't be the same if you're navigating the marketplace in states that, for example, are on the federal marketplace that don't bring the same resources for language equity that state marketplaces do.
Thanks all. Our next question is from Amy Lotvin from Inside Health Policy. And I'm wondering if I could actually, it's a two-part question. The second question is about elaborating on some of the timing issues at play here. Danielle, I wonder if I could direct that to you first and then invite some of your other peers to speak to that if they want. And then to queue up the second question for anyone who wants to respond, just curious about conversations with the Senate for any of you who have been talking to your representatives and how those have been going. But first on the timing issues, Danielle.
Sure. Thanks, Christina. So the magnitude of the changes that are in this bill are staggering for all of us. We've all been successfully operating marketplaces since the early days. The number of changes, we simply don't have time to implement the number of changes that are put in place here to do things we know how to do well already. That's one. I think another timing piece that I would mention is cutting the open enrollment period. In many states, it's being cut in half. That'll be news to a lot of consumers who are used to the regular processes. That's another timing piece. But simply, I would just say, and then the other timing piece that I think is relevant is we're all in the middle of our rate setting process, and rates have been submitted and will be approved in the coming weeks. They're all conservatively assumed all of these changes, the expiration of the premium tax credits. Just anytime there's uncertainty, issuers come in with high rate increases. So it's just exacerbating all of these other problems. And of course, the loss of the subsidies will be detrimental to our consumers.
Thanks, Danielle. Anyone like to add to that on timing issues? Go ahead, Jessica.
Yeah, I just really like to add a fine point on the expiration of the enhanced subsidies, which is the one thing we're talking about today that is very much impending and on the table, but also very much not included in the reconciliation package to be addressed. To reframe the timeline, open enrollment starts in less than 5 months. The state marketplaces on this call will start putting letters in the mail to our consumers in the early fall. September, October is the most common time frame, and rates need to be finalized before that. So I think this is not going to be decided soon, but all of us are going forward on key parts of our operations in order to meet the open enrollment timeline that, again, we no longer will have flexibility in what that timeline is. So time is absolutely of the essence, and certainty would lower costs even more to get it sooner rather than later.
And any comments on Amy's second question about conversations with leadership in your state on any of these issues?
I can take that on, Christina. We have in Maryland, Michelle Eberly, Executive Director of Maryland Health Benefit Exchange, and we've been doing a two-prong approach. Obviously, we've been communicating with our federal delegation. We started last fall on that, providing materials. Christina, I noticed that you put in the chat the link, or someone put it from Nashville, the link in for a whole bunch of materials that the network has been working on really swiftly to get explainer pages and such, and we've been sending those to our federal delegation, as well as briefing our state legislature. Part of the challenge as well is that many legislators, as Hillary mentioned, their session is ending in May now. Our session has already ended, so if we needed to take any action, it would not be until next year. And so that provides some challenge to us, particularly around if the cost share reductions, and I know that's in the bill, not the expanded tax credits, but if those were put into place or those were funded, with the caveat as it has today that states that provide abortion services would not get that funding, which Maryland is one of those, we would not be able to address that until our next session. So timing is critical in many of these things, if anything that has the 1/1/26 effective date.
Thank you, Michelle. Any other questions?
Hi, can I ask a question?
Go ahead, Paige.
Yeah, with Paige Cunningham with the Washington Post. And sorry, I missed a little bit of the call, but I wonder if any of you could just kind of like take us through what it might look like on the ground for your marketplaces if the legislation becomes law. And I know you already talked about the change in the the 6-week enrollment period, but I'm just wondering. I know there are a lot of like kind of technical changes in this legislation. And so I guess I'm wondering if any of you could just kind of address how some of those technical changes would change things for you. And then also the question, I think one of you alluded to having to potentially hire more marketplace staff.
Anybody want to jump in here? What this will look like on the ground?
This is Devin from Pennsylvania. I can add a little bit of color from how we've been planning for this. So really there would be a lot of forces happening all at once. So we have a record number of enrollees, like many of our counterparts across other states, who would be facing significant changes, both cost increases and new paperwork, shorter times. So we would really be needing to address and support consumers with much less time to do it, much tighter resources to do it, while also trying to get them through a process that many of them will find overwhelming in terms of the cost increases and what their options are for them. So I think on the ground, what that looks like is a lot of confusion, a lot of frustration from our enrollees is what we anticipate in seeing the significantly increased costs and having fewer resources to be able to support them. So typically our open enrollment goes until January 15th, for example. So we're now would be trying to serve 500,000 Pennsylvanians in 45 days instead of that longer period. It's just going to feel very crunched and at a time when people need the most support and need questions answered in a way sort of facing unprecedented changes. We're going to be in the least position to be able to support them. And so I think that all just continues to exacerbate the confusion, the coverage loss, all of these pieces kind of amplify on each other and compound on each other to further increase costs, further increase red tape, and have less support to get through those issues, all creating the coverage losses we're talking about. In Pennsylvania, if all of these go into place across various timelines, many of which are very quickly, but some provisions are later, we are looking at up to potentially half of our enrollees not being able to afford it anymore or not being able to navigate the new bureaucracy and having to drop coverage.
And I can just add, we've had the privilege as marketplaces the last few years of trying to really understand the remaining uninsured with record low uninsured rates across the country, trying to understand that population, know their barriers, connect them to coverage, and really been obsessed with whittling that number down. As we look to this open enrollment period, and really with some of the provisions kind of taking effect over the next few years, we really are shifting our mentality to retention. And can we keep the people we have? Can we maintain the progress that we have made? And what are the tools in our toolbox to do that? Going up against really every type of headwind that you can think of, from significantly increased costs to significantly harder administrative processes that our consumers will have, and to really having our hands tied from using flexibilities that have let marketplaces be successful in other moments of uncertainty, like changing our enrollment periods, giving more time, all of those things that we will not have the ability to use. So we are up against a lot, but this is a group of people and organizations that will do everything in our power, including adding resources. Our board just approved an augmentation to our budget to allow us to meet this moment and meet these contingencies. So we're prepared to do that, but it is going to be an uphill battle.
I'll add a couple just operational pieces. One is that I think it's important to know also that for a lot of us, our technology roadmaps of like enhancing our eligibility enrollment platforms to make them more consumer friendly or add features that have proven to be problematic for folks, or to every year we have regulatory changes that we have to comply with. These would be these legal proposals would be the most substantial in terms of the volume and the extent of them. But those technology roadmaps are planned months, if not a year in advance. And so for a lot of us, we've already been working with our platform vendors to figure out, what's in the works before this open enrollment period. And so taking all of these new changes is going to have to completely pivot those roadmaps. So we would be exploring them to see what can come off of them, what we're going to be able to get done from these changes. And the ones that we cannot, as I said in my remarks, it's about not implementing. We like to implement things thoughtfully, in the most consumer friendly manner, and also meeting security guidelines to keep people's information protected, making sure we have processes that have checks and balances in them. And when you have to implement so quickly, we really run the risk of having to do stopgap measures or workarounds that likely involve much more human interaction and manual interactions rather than automated procedures. And humans are human and they can make errors. So we will actually be more susceptible to errors or human error. The other thing I'd say is we all also have marketing and communications budgets and do direct to consumer outreach. And as Jessica alluded to, all of that will be focused on or most of it will now be refocused not on attracting new consumers, which is what we're always trying to do, but on communicating to our current consumers what the changes are. And a lot of different changes, and consumers are not going to be able to retain like a list of 10 things. So you have to figure out how we communicate those things multiple times in multiple ways to meet people where they're at. And then for states like our state, where we operate within our Department of Health and Human Services, and we operate in partnership with our Medicaid departments as no wrong door for coverage. And so these also, when you look at the Medicaid changes, if people are losing Medicaid coverage, we're going to have to see whether we can bring them into the marketplace, which again creates challenges to already, limited capacity of state employees. And for us, we are a state government agency, so we can't just add state employees like that. They have to be approved by our legislature. Again, our legislature doesn't go into session until January. It can be really challenging in political environments to get new positions. And so then we're talking about figuring out how to hire contractors, and we may just not even be able to hire additional staff, just like we may not be able to raise our user fees because they're done through the legislature, our own viability.
Christine, if I can just add one other thing, because we've talked obviously a lot about the impacts to our consumers and to the network or to our operations. One of the other things is the unintended consequences that, we're not addressing here, but we've had folks come in during the pandemic when they lost their jobs, and then they said, hey, I could start my own business because I have affordable health coverage. So now if they're losing that, now we're talking about, the economics of our communities. We're talking about hospitals. We're talking about our providers. I mean, there's a lot of unintended consequences that we don't even know yet what is going to play out from this bill. So I don't want the day to go before we address or at least mention that.
Go ahead, Kevin. Thank you, Michelle.
Yeah, sorry, I didn't know where we were with our time, but two things I think are make what's a simple question very difficult to answer. I think anytime you're talking about a technology implementation, which the base of what we end up having to do, in the technology world, you get three components to whatever is in the project. It's time, money, and quality. Those are three components you're really focused around. Well, we're talking about a very shortened timeline, so that one's out. Nobody's giving us any extra money, so that's not in it. So the only thing left is the quality. And so it really puts us in a pretty tough corner on how we are able to, after years of actually getting great relationships with our customers, our stakeholders, on the quality of the work that we've done, to really see that really start going another way when we just don't have the ability to respond in a way is a tough situation, I think, for all of us. I think the other part of the question, though, is that there's such a large number of substantive changes in this conversation. It's like you're looking at multivariate regression analysis, and you're looking at the variables, and I'm not sure which ones you have a great deal of confidence. The confidence interval level is not going to be 95%, but we're trying to say how these impacts are going to be felt, and I think they are going to be all over. It's not going to be one or two things, which we're used to kind of dealing with every year. There's always something that's like, okay, we've got to deal with that. But this is just a barrage of pretty big topics for us to try to manage. And I think hearing the customer stories in this is the part that makes it just challenging to say, we know what this is going to impact, and what the stories are just accurate in terms of who we've been able to help and how it will negatively impact them.
Thank you, Kevin. And I realize that we are at time for our event. So I would like to first off thank all our participants on this call. And again, thank everyone who joined to hear more about this very important issue. If you do have questions or are interested in the recording, please contact Dawn Stoltzfus at Nashby. She has put her email address in the chat, and she is happy to help direct your questions to any of our participants, as well as to send you additional resources. Again, thank you to everyone for highlighting these very important issues, both the operational concerns and that very real impact to your consumers' everyday lives, businesses, and your states. Really some very, very critical concerns for all of you. Thank you again, everyone, and we hope everyone has a great afternoon.
Bye.